Hey guys, Coach JJ here, and I don't normally do talks like this. Well, not in this way, and not even really in this aspect, but this is very important to me today, and I want y'all to listen to what I have to say. I'm speaking off the cuff. I do not have prepared remarks. I've just been thinking a lot about this issue, and we're going to talk about healthcare, and hopefully the overlords don't ban me or kick me off for talking about this, but I have to talk about it. I have to talk about it. I have to talk about it. And you'll understand why by the time I'm done. Pardon. Long COVID, nasal drainage, pollen outside. Anyway. So, many of you have probably heard about a case going on in the state of Tennessee with regards to a nurse who ended up contributing to the death of a patient. And this was at Vanderbilt Medical Center, for whom I have the utmost esteem and respect for, because we have been treated by them. They actually saved my children's life. Who is it? What the hell's her name? I'm sorry. Again, I'm speaking off the cuff, so I'm going to cuss and I'm going to go back and just listen. Hear me out. I'm trying to make this quick. Dr. Shilpa Reddy, she's my children's neurologist, and she fixed them. Like, she literally saved their life. And she's like the chair of the Department of Epilepsy, Neurological Studies at the university, and fantastic people, wonderful things. Never had anything but excellent care from them. Nonetheless, that doesn't speak to the other areas of this hospital. In this particular hospital, there was a nurse who was on staff. There was a patient that came in for suspected brain bleeding, and then I think the initial assessment said, yes, we have brain bleeding or something like that. She was in there, she was getting better, and then they say, go down and have another MRI and let's check your brain progress. And so this nurse was supposed to take her down, which she did, and she had a student nurse with her, a trainee with her. So that was another thing she had to mind, and brought her down to the place, went into the computer system to try to pull up the medication that was required because the patient had orders for a sedative because of anxiety from being put in the MRI tube. And I know lots of us have that anxiety, right? I actually experienced it some myself. Now I'm used to it because I've had it happen so many times. But initially I was like, oh my God, don't put me in there. I'm going to freak out, right? So it's common for people to have that complaint. And so there's medication. The nurse was in the middle of training a trainee, more than likely was tired. The hospital had installed a computer system that was supposed to communicate between the medical record and charting that the nurses and doctors are doing versus the physician order system versus the pharmacy inputs, and all of those things are different. And there's a few other things on the back end that go into that. So this new system got put in, and when she pushed the buttons to bring up the medication, it didn't work. It did not bring up the medication that she was looking for. So for multiple days, I think before this incident specifically happened, and then a certain extent of time afterward, nurses had a code that they could override the system. And I can attest to the validity of having to have had to do that over the course of my entire career. Like, this is nothing new, actually, because systems don't seem to keep up with each other, and that's a very interesting thing. So that aside, she put in the thing, it dispensed the wrong medication, but the medications looked similar because they had a similar colored label, and a couple of letters that looked the same and they had the same red top on them. So it could be very easy to just be like, okay, yeah, that's the one. I mean, go over and do this. What ended up happening was the medication that was just for anxiety sedation to just kind of make you feel relaxed. This thing paralyzes your entire body. And like that includes your lungs and all of the muscles that like keep you alive. And so because this nurse mistakenly pulled out this medication and gave it to the patient passed. And as soon as this nurse figured out, oh my God, I made this terrible mistake, let me go tell somebody, she went and did so. She reported it. And the hospital said, okay, thank you for telling us. You just hang out over here for a minute. This happened in 2017. The hospital was supposed to report this to the Centers of Medicaid and Medicare Services, CMS, as we call it. They were supposed to report this. They didn't. It doesn't appear that anyone got fired. It doesn't appear that anyone did an investigation into the computer system stuff, or anything. If those things have been done, they've largely been kept quiet and not public information, but nothing happened. Just a few days ago, this nurse was convicted in court of criminally negligent homicide. She got convicted of murder. She didn't murder anybody. These were errors that spanned across the entire system. Yeah, could she have done a few things differently? Abso-freaking-lutely. Never, ever, 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 ever. When you're messing with somebody's sedation, cognitive function, something like that, medications, whatever, always get a double check. I don't care if you've been a nurse for 30 years, get a double check anyway. Because you might be tired, your glasses might not be right, maybe you didn't eat right. It doesn't matter. You're capable of making a mistake. I've made those mistakes myself as well. Fortunately, none of them would have been fatal. I thank God for that. Except perhaps in some indirect fashion they could have been. And a lot of professionals, when they get into the field and they've been doing it for so long, something comes in and they're like, yep, I know what that's it. I know what it is. And they don't look because they automatically say, well, I saw this and this and this, and I know exactly what I'm expecting. Just come on. They don't want to waste the extra time. And I get that, especially when you're in the hospital floor or some other setting where your stuff's like you have to be super, super quick. You have to be like, where's that med? Bam. Okay, where's the tubes? Bam. Where's this thing? Get it done. You know, I get all that because I've had to do it, but we can't be rushing people. And so this goes into another thing of the fact that when we go see a doctor or other like provider, you know how much time they have to talk to you? Like 8 to 10 minutes. If you're gonna be trying to figure something out between 8 to 10 minutes, you have to be really, really, really damn good at what you're doing. Very precise, have excellent communication skills, and also have a team in place that will double check you. Not because they think you're stupid, but because they say, we got to double check this to make sure we're hitting the mark on this patient for whatever treatment it is that they're coming in for, right? So as providers, we have to not let our ego get in the way of recognizing that we are inherently flawed. It doesn't matter who you are, how much education you have, how many degrees you have, how many hours of clinical training, how many hours in the class. None of that stuff matters. What matters is that you are paying attention and you are understanding the scientific fundamentals of what you're supposed to be doing. And most importantly, if you are unsure at all, one iota, I don't give a shit if the charge nurse gonna be pissed off at you because it took an extra 5 minutes. I don't care. That extra 5 minutes where the hospital may have lost $15,000 is not going to replace the life that is lost either through death or disability because of something we didn't do, because the money makers are on our back. Hurry up. You got to do this faster. Come on. No, you can do this. No. Well, no, you don't really have to do that. I just put in this override code. Because clearly, that's how people fucking die. Sorry for my language, except I'm not, because I'm really pissed off about this. This nurse should not be prosecuted. All the things that we have to do on the clinical floor, doctors, nurses, respiratory therapists, speech pathologists, physical and occupational therapists, people, psychologists, psychiatrists, all of these, the stuff we have to do, no. It's without a solid team, without the data things in place that we are told will help replace our inability to remember everything all the time, constantly. We're told those things work. They don't work. The management doesn't support us. We're tired, overstressed, underpaid, understaffed. Mistakes are going to happen. If you're a restaurant owner and you decide you're going to make a batch of cupcakes and you don't follow the proper precautions with maintaining the kitchen safety, because you're tired and you're like, I didn't actually maybe touch that thing, I'm just gonna throw it over here, and it had egg or something on it, right? And then you use something there that had some of that egg that you didn't see, or said, I'm not gonna worry about it, and then you made frosting to put on the cupcakes, and the people took the cupcakes home, and then they end up with salmonella infection. Do you think that you deserve to go to jail for that? I don't think so. And I probably better shut my mouth now. Don't judge this nurse, because it could have been me. I've made mistakes, like I've said. Thank God we caught them. But this risk, you're asking these nurses to go to school, bust their ass, work for like 6 months minimum without pay, go work to get the credentials to do this, and you're putting them on the floor and you're paying them $25 an hour. That's what they pay around here, although with COVID they've increased some of that, but it depends on what it is. $25 an hour. You're going to ask them to put their life on the line where they could possibly go to jail for mistakes that maybe they wouldn't have made had the other systems been in place correctly. No. Not by this nurse. I'll be damned. It's not looking good in healthcare, y'all. It really isn't. I'm really concerned. Really, really, really concerned. And I have both the privilege, but also the horror of having professionals that are higher credentialed than me asking me for help. Why? Apparently, I listen better, I give better confidence, and I've read more. I don't know what else it is to explain that, but that's my spiel. I should shut up now. Go do something useful besides running my mouth. Thank you for taking the time to listen. Share this with anybody you think that can benefit, especially healthcare providers. Coach JJ out.